Hey, good morning, everybody. Steve here from The Varied Life, and today's video is a little bit different because we're going to talk about Korea, healthcare, and being an expat over here and getting medical care, and kind of talk a little bit about the healthcare system here in Korea, the national health insurance, and our experiences, or my experiences that I've seen and done in regards to just regular checkups or something serious like surgery and an overnight stay in a hospital. So we're going to go over some stuff here. Let me get my notes. So basically, in South Korea, well, a little bit of backstory. Let me kind of back up. My wife and I, what we ended up doing is selling everything we owned in the United States. House, cars, pots, pans, everything in the kitchen junk drawer. And what we ended up doing was throwing stuff in a couple of suitcases. And eventually we came and boom, we retired here in Korea. Now it's kind of a different thing because when you think about overseas retirement, Korea isn't really on the top of the list for that. You'll see like Philippines, you'll see like Thailand, you'll see like Bali, you'll see a lot of other countries that are more expat friendly or overseas retirement friendly than Korea. And so, we kind of considered a number of different places, and, Costa Rica, Dominican Republic, Puerto Rico, South America, some places, definitely not Mexico. Saw that coming, crime and cartels, that was off the list. But considering, Philippines and Thailand, we had been to Thailand and really liked it over there. Heat, humidity, that's kind of a kicker. I'm more of a cold weather person. My ancestry is German, way before that, Viking, stuff like that. I'm 6'2". My dad was like 6'4", 6'5", big guy. Definitely have that type of trait. Like the cold weather, don't like hot, humid. But what we ended up doing is we were kind of in limbo in regards to overseas retirement. And then we found out that my wife, who was born and raised in Korea, and then we dated and eventually got married, and she's awesome, incredible. And then we came to the United States. She became an American citizen. And so we're both American citizens. Well, then we found out that we could get a long-term visa here in Korea for an F4 visa for my wife because she would be a returning Korean national. So in other words, because she has Korean ancestry, the rest of her family's in Korea, that she could put in and apply for an F4 visa, which will allow her to stay long-term in Korea. And then me as her spouse would be able to get an F1 visa. So the whole thing with that works out really well. And let me see if I can back this up and make things, there we go. So that would allow us both to stay in Korea long term. So that kind of worked out. There are some things you need to be mindful of because with an F4 and F1 visa, you cannot work in Korea. So in other words, I can't go to a Korean company and work, get paid by a Korean employer and so on and so forth. But let's say I have a digital job. Maybe I sell goods and services over the internet, information. I got an Amazon site store or whatever. I don't. Or you have some type of business in the United States that you can run remotely from anywhere in the world. You're kind of like a digital nomad. Or you have dividends, or you have pension, kind of like I do, and healthcare coverage and all that. So then you would be able to continue working in the United States, but you just live and you're retired in Korea. So that's what we ended up doing. But with that, there are some other considerations. There's always, the hurdles of jumping from one culture to another, which really, even though my wife is Korean, and we spent a lot of time away from Korea. So when we left, the last time that we actually lived in Korea was 2002. Visited a couple times since then, but the last time we lived here was in 2002. So when we came back, there was a little bit of a culture shock because we spent so much time out and away from Korea and so much changed. And part of the things that changed is the Korean healthcare system. Not changed, I guess, so much, but it's different compared to the United States and the healthcare system that we had. So the Korean healthcare system is pretty good, and it's ranked as being the world's best. For example, the OECD's highest colorectal cancer survival rate is 72.8%, which is a lot higher than the United Kingdom and other places, which is in the 50s. The public healthcare system is called the National Health Insurance Service, so the NHIS here in Korea. It's universal, it's funded by the Korean government, and it covers 51 million people, getting close to that 52. So, but that doesn't mean it's free. Everyone, including foreigners living in Korea, and I'm referring to my notes, you got to pay into the national health insurance system. And usually that comes out to about 123,000 won per month, which is roughly about $95 to $100. So when you get here and you're in a long-term visa or you work or whatever it is, kind of like our situation, the F1 or the F4 and the F1 visa, excuse me, then you're eligible and you will get a letter sent to you saying, hey, okay, well, you've been here X amount of months. Now it's time to sign up for the healthcare system here in Korea. And you got to start paying that $123,000 or 123,000 won per month. That's a big difference there. But there are some exceptions on what you can do in regards to healthcare insurance. So if you have private healthcare insurance that will cover a certain amount, and you have proof of that, you can take that and apply for an exemption here in Korea so that you don't have to pay that 123,000 won. Now, some retired GIs like myself, they have a Korean spouse, they come to Korea, they do exactly what we did, the F4 and the F1 visa, and then they just say, nope, I'm just going straight for the Korean national healthcare system. I'm not even going to deal with anything, Medicare be damned or any of that, because I'm going to stay here in Korea forever until till I kick off this mortal coil. The problem with that is that it's probably not a good idea, because never say never. Okay, so people say that they will never go back to the United States. What ends up happening, it bites them in the butt, and they end up going back to the United States. Something happens in the United States, they need health care, and they don't have health insurance, and they just have the Korean health insurance, which doesn't translate over to the United States, being on a visa. So that's kind of problematic. So try to keep your health care, don't sign away your Medicare and Medicaid and so on and so forth. There's obvious reasons why, because if you go back to the States and something happens, you want to have something to fall back on. And Lord knows, it wouldn't be the first time that somebody retired overseas and then had to turn around with their tail between their legs and go back to the US. That's never happened, has it, ever? No, there's the interwebs is littered with stories of people who retired overseas all over the world and then hightailed it back to the United States because for whatever, various reasons. So anyway, back to the healthcare. Again, the Korean national healthcare is about 123,000 won a month, or about $95, $100, and that covers pretty much everything except you cover 20% of the medical treatment. So it's kind of like you do a copay and the insurance pays the rest. The good thing is with this type of system, pretty much everybody gets covered as long as you can pay for your monthly insurance, which is good. Some people have asked me, now this is kind of, let's get off the main highway and we'll go down a rabbit trail here, go off an exit and we'll kind of ramble a little bit. People ask me between, what do I think about free healthcare, where the government pays for everything? And it's like, I don't really like that, because usually there's way too many people, not enough doctors, and free, somebody's got to pay for it. So nothing is ever free. Nothing is ever free. So somebody's got to pay for it. And usually it's the people that have to pay for it. The only reason that I would like a free healthcare system to the people is if, and mind you, it's nothing is free, is that if the country had natural resources that they sold to other countries overseas, and then you jack up the taxes and tariffs and whatever, and that pays for the medical of the people, then that would be the only reason why I would say that would be acceptable. Other than that, no. You have a vested interest to have health care, you make payments, and you're not a slug. So anyway, there's that. So anyway, yeah, you pay the 123,000 won per month. You cover covers 80%. You cover 20, and it's really affordable compared to the United States and a lot of other places. It's really affordable, but here in Korea. With that being said, on the Korean side of the house, the doctors, the nurses, and medical staff, they make less than what they would here in the United States. But it doesn't mean that you're getting any less quality care. I'll talk about some things about that later on. Now, the National Health Insurance here in Korea allows people to use any hospital or clinic in Korea for medical needs, which is good. There's some really big hospitals in Korea. And again, we got 51 million people here in Korea, in the peninsula of Korea. So, but a lot of that is condensed around cities. And so when you have hospitals, a ton of people go to the hospitals. Now, there's also smaller clinics that are usually in smaller cities, smaller towns, and a lot of medical care is provided by clinics. As in our situation, I have Tricare from being retired in the U.S. military. So I had Tricare and Tricare Prime. But when I came over here to Korea, there's the option to change it to Tricare Overseas Select or Tricare Select Overseas, whichever one it is. That would allow me to use my Tricare, and so the Korean hospitals or certain clinics that will process that paperwork with Tricare Overseas. It's quick, painless. I don't have to do anything. It's automatically done, and it's good to go. Now, there is a way that you can go to a non-Tricare approved clinic or hospital, but that requires you having to pay for whatever treatment that you're getting. Then you submit that to Tricare, and then Tricare will reimburse you after the fact. So you got to have some of this to get this over here, and there's that little waiting period in between. But for the Korean health insurance, you're going to have dental, your medications, inpatient care, outpatient care, health checkup, cancer screenings, and things of that nature. If you have private health insurance, you're going to pay possibly a copay every time you go to the doctor. So for example, when I go to Good Morning Hospital, that is in Pyeongtaek, Korea, or if I go to Samsung Hospital up in Seoul, which I've been up there unfortunately for my surgery, it's quick, it's easy. My Tricare Overseas Select pays for it. I might pay a small copay or small amounts to see the doctor, which isn't bad. It's kind of comparable to the United States, $20, $25, $30, $15, somewhere around there. It depends on the specialty or what I'm being seen for. So, it works out really well. The only thing, we'll get to that a little bit later. It's very different, the United States and Korean health hospitals. So let's see what some other stuff we're going to go over. Refer to my notes. The difference between Korean hospitals versus American hospitals. Now, in my experience, and this is what I'm basing it on, my experience in American hospitals, you go to the hospital, you check in, you have an appointment that you either made online or you called and made an appointment. You see your PCM, which is like a GP, a general practitioner. It could be a physician's assistant. It could be, somebody like that, somebody you're assigned to as being your your primary doctor covering everything unless you need a referral for a specialist. So you go to the appointment, you'll wait, 35, 45 minutes. That's kind of been our experience in the United States, in the mainland and overseas on Oahu, is you wait 35, 40 minutes, and then you see the doctor, and the PCM will pretty much do everything. And then after that, if you have a problem, then you get a referral. Then you have to make another appointment, or another appointment is made for you. Then when you leave and then you come back to see that specialist, you see them, and then they say, okay, well, what is here? And then usually there's another appointment before you can get medication, unless it's something really serious. Usually you have to see, specialists 1 or 2 times, and the second time and afterwards you will get medication or treatment or whatever it is. So there's kind of seeing your GP, getting the referral, seeing the specialist, and then seeing the specialist again. When it comes to medications in the United States, you will see your GP, and if you have existing prescriptions, you can get refills from your GP or your PCM, which is really good. Sometimes in a lot of areas, you can get prescriptions for mental health or, pain or other things for, stomach issues and maybe andropause and menopause and all of the pause things that come into your life. You can get prescribed from your GP, which is good, because then it's kind of like a one-stop shopping to get all your prescriptions and refills. And refills are usually done, in our experiences, like 90 days. So you get a refill, get your prescription for 90 days, and you're good for 90 days. And then with refills in the United States, our experience is they will give you X amount of refills that it says on your bottle, hey, you got 3 refills. And so when it's at the end of that 90 days, simply call up the pharmacy, say, hey, boom, and then they reissue and do your refill. You go pick it up and you're good for another 90 days. So however many refills you have that's listed on the bottle, you're good to go. So let's talk about Korea. Korea is a little bit different. Now, when you first get here into Korea, you can, let's say you've been on a medication in the United States for 20, 30 years. You have it in your medical records, it's documented, the whole 9 yards, it's here it is, this is when it started, and for the last 20, 30 years I've been taking this medication. When you first go to a Korean hospital, you don't see a GP. They don't have PCMs or general practitioners. In other words, they don't have a single doctor that is assigned a certain number of patients for you to see and do what we did and experienced in the United States. Pretty much, if you have, let's say, a pain management problem, you have to go see the pain management doctor. If you have vision problems, you have to go see the ophthalmologist. If you have stomach issues, you need to see the gastrointestinal doc guy. If you got, some mental issues, you got to see the head shrink and psychologist type person. And so each of those requires a different appointment. So if I have medications in each one of those areas, I have to have an appointment with each one of those specialists, which is like, wow, that's a lot of appointments. And a word of warning, when you come here to Korea and you're an expat and you have your visa, whether you're working or retired like we are, when you go to the Korean hospital, you will probably get a full physical. If that hospital is going to be your home base hospital, they will end up doing blood tests. They will do, the full physical. They could do some x-rays, depending on if you're a man or woman, to do the appropriate tests and so on and so forth, bone density, lipids, the whole 9 yards. You can't just go to the Korean hospital and say, okay, well, I've been on this medication, and I've got all my medical records showing that I've been using this same medication for the last 20, 30 years. You can't give that to a Korean hospital and they'll say, oh, okay, well here's a prescription. No, they have to do, it's like starting all over. So it can be a little bit frustrating to get prescriptions because if you're running out, and I highly suggest that people come to Korea, bring 90 days worth of medications or more if possible. And you might say, well, how do you do that? You know, when you see your PCM in the United States and you say, hey, I'm going overseas on an extended trip, I'm going to need 90 days worth of medications because we're touring the world and whatever. We've found that the majority of doctors will give 90 days worth of that medication. So in timing your overseas retirement, you might want to say, okay, well, I just got my prescriptions filled, so I have 90 days. Before you leave, go to your PCM and say, hey, we're going overseas for 6 to 9 months and I'm gonna need another prescription. Many doctors will issue another 90 days worth of medication, depending on the medication. The thing you don't want to do is be on the last 1 or 2 pills in your prescription bottles, come to Korea and then think I'm just going to go in, they'll give me refills and it'll be fast, quick, and easy, because it won't. There needs to be an evaluation period. So for example, if there's mental health meds that you're taking, when you come to Korea, you have to get an appointment with the mental health guy, the psychologist, psychiatrist, whatever it is, and they'll do an assessment of you all over again, and then they will go through their protocol, and they might not put you at the dose that you're at. They might start you back down at an entry-level dose and then work their way up, because again, you know, there's some liability issues concerned with that. You're no longer in the American healthcare system. You're now in a foreign healthcare system, so they're covering their butt. So don't get frustrated and mad because they're making you start all over again. It's like you were just born. You just, boom, popped up and here you are. And so now you have to follow their rules. As far as wait times, here in Korea, I've been to Good Morning Hospital. Wife's been to Good Morning Hospital. We've been to Samsung Medical Center up in Seoul a number of times, and the wait times are not bad. Now, having to travel to Samsung Medical is a little bit of a trip, because we end up taking the train, or there's a free shuttle from Camp Humphreys walk-in gate here in Onjunggi that will go at like 7 o'clock in the morning or something like that, and it gets up there at about 9ish, and then it leaves to come back to Onjunggi, Camp Humphreys walk-in gate at I think it's 1300 or 1330. So if you can get your appointments within those times, then you're good to go. But that hospital is huge, and it serves an inordinate amount of people. It's like a busy rush hour bus station, train station. It is filled with people. It's very jarring and very different than a United States hospital, which is like, oh, you come in, you have some nice waiting rooms. No, this is more, it's just more people, more doctors, more kind of a Costco wholesale, you know, go by the numbers and be efficient. That's what it comes down to, because with the number of people they see, they don't have time to pussyfoot around. So with that, it's the wait times you might think are bad. Some people have said they are, but in our experience, we found that, let's say, you know, we get there in the morning early, but the appointment isn't until 11, and it's like 9:30, 10 o'clock, especially with Samsung Medical Center. We've been able to show up early, and we're able to get tests done early, see the doctor early. I'd say about 70% of the time. So that's kind of a good thing. So that gives you some flexibility that if you get there early, you can be seen early at times, depending on their schedule, and they can fit you in. And it's like, okay, that's one thing I'm really impressed with in regards to the Korean healthcare system, is their ability to see people early, or if they find things out that are very important, they order additional tests and they can see you and get you done that day. At least that's been my experience. So as far as wait times in hospitals, it's not bad. The only besides the mass of people that remind you of a rush hour bus station or train station or crowded mall, is the lack of air conditioning. I'm generally, I run hot. As you know, I'm 6'2", 255 pounds now, and I run warm. Okay, so in hot weather and humid weather, man, it just gets me. But I have noticed and talked to other expats that the Korean hospital's air conditioner is not set as high as what you would see in an American hospital. Be aware of that. So if you need to bring a hand fan or a little electric fan, throw that into your bag. They're great for trains if they're standing room only, or just standing on the corner waiting for a bus or a taxi and you need some some relief in the hot, humid weather. Yeah, you might want to be aware of that. So just kind of giving you some information and things that we've experienced that is like going to the hospital and it's just like hot and humid and it's like, don't touch me, and you get irritated and frustrated. And yeah, there's that because the humidity. So anyway, let's see. Difference between hospitals and clinics. Let's say you can go to a major hospital. Like we could go to Good Morning Hospital in Pyeongtaek, and that will do pretty much everything except for ophthalmology, surgeries and things of that nature, but everything else pretty much they'll do. If you have like cancer or something really bad, then you would go to like Asan Medical Center, Samsung Medical Center, some of the top 3 or 4 hospitals that deal with those things. You get much better care. Kind of like in the United States, there's hospitals that are like down here, and then you have hospitals that give really good care. Sinai Medical Center's got real good care, but you're gonna have to travel, and it's kind of the same thing here in Korea. But if you end up with something that's not life-threatening here in Korea, you can go to a local clinic and you can see the nurse, they take your vitals, you see a doctor, and it's like, hey, I've got the flu, I got the sniffles, I got sore throat, strep, whatever it is. You can go to a local clinic and be seen and pay out of pocket. And like I could get reimbursed through Tricare and so on and so forth. But if you don't have Tricare Overseas Select, you can pay out of pocket, and you'll be amazed for just those non-emergency type of things with, I just got cold or flu, strep, whatever it is. You'll be surprised at the price is really affordable. So if it's something small and you just need something to treat the symptoms, you can go to a local clinic, get treated that way, and that works as well. There's one other thing that you can do, and that's go to a Korean pharmacy. Now, obviously, if you see a doctor, they're going to give you a prescription. You can get that prescription filled at a Korean pharmacy. But you can also go to a Korean pharmacy and say, hey, here's the deal. I'm coughing, I got scratchy throat, I'm congestion, I got fever, so on and so forth. They will give you over-the-counter medications at the Korean pharmacy as well. So it's a great place to get your prescriptions, but also get over-the-counter medications, and the people that work there are trained specifically on that to listen to your symptoms, and they'll give you what you need. And the prices for those medications they're not expensive, they're inexpensive, and it's a great alternative instead of going to a clinic for the sniffles and flu, or going to a major hospital and just going there for a cold pack. So, let's see. People have asked, well, since you got here and you got your Korean registration card, Korean residence card. It used to be called the ARC card, alien registration card, but then alien became an offensive word to some people. I don't know why. But once you get your Korean residence card showing that you have a long-term visa, usually about a month to 2 months afterwards, you will receive a letter in the mail saying that you need to register for the national health insurance system here in Korea. So with that, you got to take your ID, your passport, your certificate of enrollment, and application form to the nearest immigration office to sign up for the Korean healthcare system. They also have forms that you can get an exception to getting the national health care insurance, kind of like in our situation of using Tricare Overseas Select. And as long as you prove that you have that insurance coverage, you can be exempt from paying that $123,001 a month. So that works out really good for us. We save a little bit of money, we still get coverage, and everything's good to go. Let's see what else we got. Here's some major medical centers that are close, I guess semi-close to where we're at, which is in Anjingni, which is close to Pyeongtaek. You have Asan Medical Center, which is one of the largest hospitals in Korea, has 22,400 patients a day. That's a lot. You can make appointments. They have an international healthcare office, which most of the larger hospitals will have an international healthcare office for foreigners. The people there will speak English or the major languages. They can find somebody to interpret. You can get your medical care. You can make payments. You can do all the stuff that you need to do. And even if you, say in my case, I don't speak a lot of Korean, they can help you get to your appointments and say, okay, well, here's where you need to go. Here's your ticket number. There's the nurse, here's the number that you need to look at on the screen to see, whatever doctor test that you need to do. So they're really helpful in that regard. You're still gonna be a little bit out of sorts because you're operating in a different language that you might not know so well, but they do a pretty good job. And in the Asan Medical Center, the International Healthcare Center is on the 4th floor for international and foreign patients. They offer translation, guidance, counseling through medical processes, reservations, treatments, the payments, all of that stuff. And Asan Medical Center has a hospital that has 2,700 beds. So that's pretty good. Samsung Medical Center. I know this one well because I went there for my surgery. And you can go to the International Healthcare Office. It's on the 2nd floor of the annex. So it's kind of like you got a big building, a hallway, an annex, and then some other stuff, but you go up to the 2nd floor, go to the International Healthcare Office, and they do the same thing. Translation services, they're fluent in English. They have pharmacies, a gift shop. They also have a beauty salon. They have banking, kind of like a convenience store, restaurants, food court area, so on and so forth. So their bed space is 1,970. So I ended up getting my eye surgery there because I had one retinal tear in this eye that they did laser surgery. It took about 10 minutes, so I was good to go on that. But this one, I had 4 retinal tears and a detached retina, if that wasn't enough, I ended up having a cataract. So they did all of those, put me under general anesthesia. They put me up. I stayed overnight in the executive suite thing. So, Tricare had to pay for all that. So that was kind of good. Had food brought up, clean, professional. Never going to Samsung Medical Center, I had never run into any staff that gave me attitude or rolled their eyes. They were always nice, polite, the whole 9 yards. And that's not, my wife is Korean, so she knows what all the staff are saying, and they never, ever have they said anything disparaged to me or my wife. Never heard them disparage anybody for that matter. So that was really nice. The Korean medical care system here, because in the United States, sometimes you don't get treated right. Sometimes there's a lot of bad attitudes. There's the rolling of the eyes. It's like you're an inconvenience to the doctors or the nurses because you're coming for medical care. It's like, listen, Johnny, I'm Jane or whatever. I'm here for medical care. I made an appointment. Stop rolling your eyes and making it seem like I'm an inconvenience to you. Don't get me started on that. Another hospital is Seoul National University Hospital. And most of these hospitals have emergency care systems or emergency rooms. Same thing, Seoul National University Hospital has about 1,780 beds. All the same things pretty much as Samsung. You have Yonsei Severance Hospital is the oldest hospital in Korea. It's highly regarded by foreigners. They have an international healthcare office as well. Everybody's fluent in English. And let's see, and it houses 2,600 beds, so the bed space is pretty good. Then you have Seoul St. Mary's, and a lot of these are covered by Tricare. Tricare Overseas Select, and I think there's another one that I don't have written down, and it's in Chonan. I think it's Chonan. But if you can do a search and you can try to find these hospitals, but most of them will use or cover Tricare Overseas Select. In Seoul, you have St. Mary's Hospital. Many of the doctors and the nurses speak English. They have an international healthcare foreigner office system. All of that stuff, their bed space is 1,400. And yeah, there's a lot of different ways to get treated. A lot of hospitals, the 2 hospitals that we've been to, and it works out well. Even been to a couple of small clinics, and in the small towns, place is nice, it's clean, the staff are always polite and respectful, and just high quality standards and so on and so forth. Just can't go wrong. Let's see what else. What other notes do we have? Overnight stay in the hospital. Let's talk about my time in Samsung Medical Center, Hospital Center. When I got my surgery, I stayed overnight, and people are wondering, well, what type of service do they have? Well, they have the nurses come in and check my vitals, had people come in and bring me meals, which was nice, bringing in medications, checking IVs. They had all the, people are like, well, it's Korea, how advanced is it? And it's these big hospitals, they're super advanced. So, the same machines that monitor your heart rate, your blood pressure, your O2 and all that stuff, all of that is here in Korea. There's a lot of advanced technology here in Korea. Once you process in the majority of your information, then you don't have to re-enter it like you do many times in the United States. So I just thought it was kind of strange. I would be in a hospital in the United States to see my primary care doctor, and then if I go and see another specialist in the same hospital, and you got to fill out more forms and the same information that you filled out before. And it's like, good Lord, I've filled out this information 5 or 6 times. Don't you have it in the system? Unfortunately, I guess they don't. But Korea seems to be more on top of records and things of that nature. Now, as far as sharing records from one hospital to another, not sure about that. I think you would actually have to go and get your records, bring those with you, and then if you go to another hospital, say, here are my records. So be mindful of that. And if you're coming to retire here in Korea or long-term stay visa, bring your medical records, get copies, and if you can have them in digital form. What we found out is the doctors here in the hospitals will ask for your medical records, and if you have copies, and you could submit those, and then they can go over those as well. So that's kind of a good thing. So if wherever you go overseas to retire, long-term visa, bring a copy of your medical records, your dental, all your prescriptions, and so on and so forth. So let's see. That's pretty much it that we got for that. Now, what are some other things I want to talk about? As far as Korean healthcare, there's more public transportation systems here in Korea. So we found that, like, when we go to Samsung Medical Center up in Seoul, we'll take a taxi, we'll go to the train station, we'll take the train, which is money out of our pocket, but it's not too bad as far as price. And then we will catch a shuttle that Samsung Medical Center, it's a free shuttle that goes from the train station to Samsung Medical. And then, of course, you can go back, but it ends at certain times during the day, so you got to be mindful of that. So if you have appointments at like 4 o'clock and afterwards, you're not going to make this free shuttle because they're pretty much done at that time. But I will say that the shuttle that goes from the train station, Suso train station, the SRT station in Seoul, to go to Samsung Medical Center, it's a free shuttle, and they have a shuttle that comes every 7 minutes. Every 7 minutes. So you know they're making big money to provide a free shuttle. And then they, like I said, they also do a free shuttle from the walk-in gate at Camp Humphreys here in Anjungi. It will pick people up at 7 o'clock. It drives an hour and a half. It gets up there, and then they leave at 13:30 and come back, and that's a free shuttle as well. So they service a lot of U.S. military and their families. Excuse me. So if you have an appointment up there, best get there early, maybe 15 minutes early before the bus gets there, maybe 20 minutes early before 7 o'clock, and then that way you be the first in line to get a seat, okay? All the times that we've used that shuttle, which hasn't been many, but it's filled up, and luckily there wasn't anybody standing on the side of the road, or kicked off the bus. So there's that. Personally, the bus ride up there is more hectic and jarring, and it's just, I just don't like it at all. I would rather pay for a taxi and the train ride, and then the free shuttle to Samsung than having to take the free shuttle from Humphreys to Samsung. Let's see, what else can we talk about? The pros and cons. The Korean healthcare system, from what we've seen so far, been here working on 10 months, is that they have a lot of people that they need to treat, and they're really efficient at what they do. So like when we go to Samsung Medical Center, when I was having my vision problems, and it was like, okay, go here, boom, get that test, go here, get this test, go here, go that test. And it's not just like one doctor and one testing station. It was like, they had like 5 or 6 of the same testing stations manned by different people so that they could cover and test such a huge patient influx. So they have to be really efficient. It's like, boom, here's your paperwork, sit down, boom, next, next. So the efficiency in Korean healthcare is really, really good. It's in, it's out, it's get treated, and there you go. So if you're used to something like the United States of going to the doctor and, hey doc, how's it going? Well, the kids graduated high school, and little Johnny, the dog had to take him to the vet, and there's none of that. There's none of that here in Korea. Not at the big hospitals, because they are working on a time schedule. And, straight to the point, get what you need to get done and get out, okay? So take that into consideration. Some of the other pros is that it's the efficiency in which they serve so many patients and do so in such a professional manner. Korea is also known for its healthcare. It's known for tourism, medical tourism. It's known for plastic surgery, cosmetic care, and so on and so forth, which somebody asked me and said, okay, well, does the Korean National Health Insurance System, does it pay for cosmetic surgery? And the answer is no, it doesn't. So that's got to come out of your own pocket. So if you want to look like a K-pop star and, whatever guy or girl pop band thing, get your fixed and whatever, augmented, that's on your own dime. It's not covered by the National Health Insurance System here in Korea. You don't get that off that monthly, $100 that you got to pay. So that's on your own. But pretty much everything else, regular dental, anything that's cosmetic, is not going to be paid by the National Health Insurance System here in Korea. That's all going to come out of pocket, unless it's like catastrophic and they have to do facial reconstruction or something due to an accident, then obviously to put you in that. But for, I need to get a tummy tuck, or, I want to get my jawline shaved, or my cheek shaped, or my nose redone, that's on you. So there's that. Medications in Korea, seems like Korea, now we're getting into the con side of the thing. Prescription medications and getting refills is a little bit more involved and problematic than it was in the United States. So it's kind of like, I wish it was a little better in that regard. But once you get started, then, it is what it is. Now, we haven't figured out if we're able to get 90 days worth of certain medications or not because we're still new into the system. You know, you have to see the doctor once, twice, and then, you know, they start you off the low dose and then, you know, record to see how you're doing on your progress, get you up to, you know, whatever it is that is good for you. And then as far as giving medications, I think some they will do 90 days, others it kind of depends. Pain medication here in Korea, yeah, that's not they're not real big on pain management like they are in the United States in regards to pills. In the United States, you know, they'll hand out pain medication like no tomorrow. Of course, after the Oxycontin thing and that whole debacle, the United States has really ratcheted down on pain management and trying to do alternative therapies and so on and so forth. But, you know, for chronic pain, I could still get a lot of medication in the United States quite easily because my case is so well documented and it's obvious that I've had, you know, I've got x-rays and MRIs. It's like, oh yeah, you're in pain. So it's easy. But in Korea, it seems like they do lower doses. So just be mindful of that. Other things that I think are a con here in Korea for healthcare is that they don't have GPs like they do in the United States. So you could have a general practitioner covering you and X amount of patients, and they're knowledgeable about your personal history, your medical history, so on and so forth. So you've got this continuity with the doctor that you're getting treatment with. So medications and refills, it's like, okay, yeah, we know what's going on. Yeah, you need a refill. Boom, out there you go. Here in Korea, you have, like I said, you have to see and make appointments with each of those specialties to get those medications. Now, I imagine after you get into a groove and they know what you are and what you need and it's justified in their eyes, then you can get those prescriptions. But getting to that point, it just, and here's another thing. The one thing for like testosterone therapy. For me, I have low testosterone. There's a high amount of veterans who have PTSD, and they also, surprisingly, have low testosterone. And the thought is that you go through traumatic experiences, it ramps up, and your body just dumps adrenaline, and you're so ramped up all the time that your body just, I don't know, makes too much, and then it just kind of ratchets back, and then the result is low testosterone. They don't really fully understand it. But then there's also the aspect of losing testosterone as you get older. And so testosterone treatment is a thing in the United States. There's optimization clinics and so on and so forth. It's a really easy protocol. You know, it doesn't cost much if you can get your primary care doctor to do it. Here in Korea, because I was running out, you know, obviously I had my medication, you know, 90 days worth. But when I went to the Korean hospital, they're like, okay, we're going to do a blood test and blah, blah, blah. And they're like, oh, and I'm like, here's my dosage, which is really low compared to TRT treatment in the United States. It's like 100, 120 a week. And the endocrinologist is like, what? You know, my wife was translating, and it's like, no, because I self-inject, you know, multiple times during the week. And he's like, no, we don't do that here. You get maybe once a month, one shot a month, one shot every 8 to 10 weeks of testosterone cypionate. And it's like, seriously? The half-life of testosterone is like, what, 7-8 days? So if you have low testosterone, your levels here, you get your shot, it kind of brings you up to an acceptable level. But then 7 or 8 days later, you're right back down or below that testosterone level, and it is actually worse. So here in Korea, and here's the kicker. So they'll only do a shot one every 8 to 10 weeks for testosterone. It cannot be self-administered, so you have to go to the Korean hospital, make an appointment, and the nurse has to give you your shot, one shot every 8 or 10 weeks. Yeah, that's just not, that is crazy, that's insane. the doctor I saw when I was translating, the wife was translating, it's like, why do you take, he was asking, why do you take multiple shots? And it's like, well, you take multiple shots of lower doses throughout the week so that your testosterone level is kind of normalized versus getting one shot every 8 to 10 weeks and then it crashes and burns and you have worse systems. It increases your E2, your estrogen, and that makes you feel like crap and crying at puppy dog commercials, and you end up watching Lifetime movies all the time and crying. So you could see him being an endocrinologist, you could see that it was like, okay, that makes sense, and he's thinking, but then it's they have their cookie cutter protocols for TRT, and that's what they do. The interesting thing is this doctor said, well, unless you're an athlete or a professional sports person, we don't do that. Are you a professional sports or athlete? And I'm like, no, even though I look like it. And it's like, no, it's just, that's the protocol that I was on in the United States at the clinic that I was going to. So yeah, if you're on TRT and you come to Korea, they don't have optimization clinics. They don't have TRT clinics that I have found yet. If you know of anybody knows here in Korea, let me know, put that in the comments, send me a message, whatever it is. Because yeah, their TRT protocol is terrible. It's just one shot, 8 to 10 weeks. That's just really, really, that's not even worth getting a shot for. I would rather go with, trying to do some herbal remedies or, it's just not worth it. So anyway, there's that. So some of the cons in Korea is they have cookie cutter protocols and because they have such a huge patient base that they have to get through in a certain amount of time and you're kind of rushed to be seen and get in, get out mentality, cookie cutter protocols are kind of more common here in Korea versus the United States where it's like, okay, you sit and talk with a doctor, these are my symptoms, this is what's happening, okay, well, and the doctor's, okay, well, let's check something, There's more interaction in my experience, with American doctors than here in Korea. Here in Korea, it's just like, okay, boom, there it is, you're done. Do you have any questions? Okay, no, boom, that, and next, Yeah, and then combine that with the lack of air conditioning in a lot of hospitals that we've noticed here in Korea, especially during the hot and humid rainy season, where humidity is high and into the 80s, 81, 82, 85%, and you're just, no matter what you do, you're just sweating. You think the hospital would kind of turn up that AC dial, but apparently they don't. But Koreans don't sweat as much like Americans do, for some strange reason. I'm not sure why that's the case, but it is. My wife doesn't sweat as much as I do, but then I'm German descent and Scandinavian and whatever, Scottish, Irish, so I'm kind of in that part of the world, and it's colder and hot weather and humidity is it's not a thing for me. If it's dry heat, I can deal with that. Be in a desert, you can drink water, I can deal with that. But you throw humidity in there and it is just rough. So, yeah, and that's what we got here in Korea. And if you're going to retire anywhere, you retire overseas, you're going to have a different medical system. They're going to have different protocols. They're going to have different amounts or ways in which they prescribe medications. Some people might be more flexible than others, in regards to countries and their healthcare system. Some might see pain management as oh, your back hurts, here, boom, here's pills, here's some narcotics, boom, you're good to go. Other places are like, whoa, what are you talking about? That's kind of some crazy talk there that you got going on. So, keep that in mind regardless of where you retire. And there are other countries, so for example, like Mexico, you can go into a pharmacy, you can buy medications. There's other countries where you can go into a pharmacy, you can buy over-the-counter medications that would normally be prescribed by a doctor. They kind of do that, take the middleman out, and they self-prescribe. Sometimes there's the questionable gray area on what you can buy in local pharmacies, not here in Korea, obviously, but in other countries to do things, whatever you're going to do. So keep that in mind, research that. And yeah, when it comes to healthcare, it really depends on the problems that you have, how you're going to face those problems, and in the future, if you're going to be a long-term expat and retiree in that country, how is the treatment for seniors? How is the treatment for people who have stroke or heart attacks, or you have a stroke and you're gnarled up and you can't walk right, you have to be in a wheelchair, crutches, things of that nature. It's great to be in Korea, where we're at. Accessibility is pretty good. Public transportation is great, but sidewalks are a little jacked up, So if you got to walk with crutches or a cane, or Lord forbid you're in a wheelchair and somebody has to push you, there's a lot of sidewalks around this area that is just not conducive to wheelchair accessibility. So that really limits on what you can do. Even just going to coffee shops and restaurants, many of them are not accessible with wheelchair-bound people. And in all honesty, I haven't seen a lot of wheelchair people here in Korea. So I guess they just stay at home. They don't really go out as much as what you see in the United States or other countries. But yeah, so think about those things, especially if you're considering retiring overseas. I chat with a lot of people online who talk about Korea. They pick up my brain about Korea and being over here, or just retiring overseas in general. Excuse me. Humidity always gets the morning cough in me. But asking questions about retiring overseas, and it's like, well, there's definitely things to consider. And, you need to play the what if game, and what happens if I have this medical emergency. One, are you going to be covered? Two, are you going to be able to live in the place that you're planning on retiring? So, for example, you have people that want to retire overseas to Philippines or Thailand or, Bali or whatever country that is, retirement friendly places. And people are like, I'm 57 or I'm 62, 65, and I'm retired, and I want to go retire overseas, and I want to live out in the sticks in the province, and so I don't have to pay high rent and, dirt roads, and I don't mind taking the bus or riding a taxi or riding a little motorbike, 45 minutes to go shopping or whatever, because, I'm only paying $100 for rent, or, but which is all fine and dandy. It's great when you're in good physical condition and you can do those things. But all it takes is one accident. All it takes is one stroke or one aneurysm or a heart attack, and just to the point of where now you can't ride that moped, or you can't ride the bicycle, and navigating dirt roads is not good. And then there's also the follow-up care. If you're living out in the sticks and dirt roads and all of that, if you have a debilitating event, medical thing that pops up, how are you going to get back and forth to the doctor or the hospital if whatever it is? So, that comes into play as well when you're thinking about care for now, but care for later, because everybody's going to get sick. Everybody's going to go through something. Everybody's going to have to get surgery for whatever. A lot of people have cardiovascular events is kind of like the number one killer of people. And before that, you have strokes, heart attacks, and all that stuff. What happens if you get cancer? What if you have, you just got to play that what if game. What if these things happen? Can I get care? Which comes to the next place. The next thing we're going to talk about is managed care or assisted living care. Here in Korea, that's something that we need to look into. We have my wife's family. Of course, it's me and the wife. But if I don't know if there's like an assisted care living facility and how, is it an option for foreigners? I haven't really heard of that here in Korea, but I have heard of that in Thailand, where there's assisted living facilities where they have on-site medical care nurses, docs there every day or whatever, for people who have those complications and need that assisted living, medical living. So other places, Philippines is really good for that. You can have in-home care, assisted care, and it's very inexpensive compared to the United States. So, for example, my grandmother, she was in her 90s, and she was short. She's a little short. She ended up being less than, she was 4 foot something. But then her back was so messed up and hunched out, just weighed next to nothing. But for her live-in care, she was in an assisted living facility. So they did her meals. She had her own room. The nurses would come by. They do activities and bingo and so on and so forth, kind of a retirement community type of feel. In San Bernardino, Colorado, was $9,000 a month. Yeah, $9,000 a month. That is insane. Of course, they did laundry, they did everything, and with the exception of even taking her to some medical appointments. So family had to take her to medical appointments, and that wasn't covered as well. But can you imagine paying $9,000 for assisted living towards the end of your life? That is insane. The majority of the people can't afford that. But that's in San Bernardino, California. If you go back to where we came from in Colorado, in southern Colorado, in the small town of Florence, assisted living in a small facility, which is no way as nice as what my grandmother was getting, but they still did the meals, they still did the medical, and so on and so forth. It was like $2,300 a month. Excuse me. So that's a huge difference. Now, if you compare that to places like Philippines or Thailand, it can be even less cost than that. So, for the people that are considering retiring overseas, especially if you're older, look into those things of assisted care facilities. How much is that going to cost you? That better arms you with information of saying, okay, well, here's my budget, here's what I have, and if I do fall on hard times medically, which everybody will, everybody's hoping they just die in their sleep and boom, they go surfing and roller skating, and then they go to bed and they wake up dead. That's what everybody kind of hopes for. No pain, just gone. But for most people, that's not the case. So they'll probably end up doing assisted living. And yeah, that's a good question if they have that here in Korea. I'm not sure. So yeah, there's that. Those things that you need to take into consideration. So anyway, I know this has been a long video, but there's a lot of people that had questions about the Korean healthcare system. How is it, for us in our experience? I will say that my medical insurance through Tricare Overseas Select, it covers my medical. It doesn't cover dental. But the dental care that I've gotten here in Korea that we've paid for out of pocket is really, really good. I ended up getting 2 implants, which, matter of fact, I got to go back and get the final teeth set in for those. And I had like 6 crowns, got those, and it was like 5,300,000 won, I think it was, or 7 million won. Let me see, 5 million divided by 1,300. No, I think it was 7 million. 7 million won divided by 1,300 is 5,300. So it was 7 million won, or $5,300. Maybe a little bit less because of the exchange rate was higher back then. So yeah, for all of that, because implants in the United States, just one implant, I've had people contact me and say, yeah, implants are like $3,000 or $4,000 a pop each. Somebody sent me one and said it was like 29 something for one implant. So, you're looking at $6,000 right there just for implants. So really pleased with the work. I got some straight teeth. The dentists were great or awesome. Just, of course, it's a well-rated dental office, dental clinic, and so on and so forth. I paid out of my own pocket, but that's something to consider as well. If you go and live overseas, can you pay? It's good to have insurance, but does that insurance cover your dental as well? So the other question that kind of leads into the next question, people are saying, well, can you have your Tricare, Overseas Select, and the Korean National Healthcare System? I guess you could do that. I mean, if you have the money, you can do whatever you want. So that way you could keep your Tricare and get that, and maybe get medical or dental coverage and other coverage under the Korean National Healthcare System. You're still going to pay for 20% of it. I don't know why you'd want to do both, but I think if you're under the Korean healthcare system, and if somebody knows the answer, actually knows the answer, I'm just throwing this off the top of my head. I think if you have the national healthcare system, that pays for everything primarily, and then with like Tricare Overseas or private health insurance, that is next. It's not like you're gonna, get free healthcare because you're on both. I don't think that's the case. So, but regardless of where you retire, whether it's Korea or overseas, some other place, healthcare is a very important thing. So, and getting somebody to tell you their experiences firsthand about these issues or about immigration issues is really important, because there are things that a lot of social media, retire overseas, and this is how much it costs to live here, and blah blah blah, and this is our monthly. Well, they don't live there. They're just going on a tourist visa, and they're tourists. Yeah, they're paying rent for a month. But they don't actually. They're not living and retiring there, so they won't have experiences of like going to the hospital or going to the dentist or going in accessing these things as somebody who's really retired, has a long-term visa, versus somebody who's just visiting for 30 days. They can get some cost estimates and stuff like that off the internet, but they haven't really experienced it to give you that firsthand experience. So, be mindful of that. Everything is rosy. Retire overseas. It's perfect. It's paradise. And you can live like a king off of your Social Security. And see, we stayed here for a month, and then they go to some other country for a month, and then some other country for a month. But do they really live there? Do they have to go to the dentist? Do they have to go to the hospital? Do they have to get prescriptions? The everyday boring life things that we all have to do. What is their experience with that? I don't know. It's great what they put out in that information, but find people who are actually living there and get their 2 cents as well. So anyway. So that's it. Check out The Varied Life on YouTube. We're going to be posting some more information. Matter of fact, we're going to do the budget video. I know I've been promising that for so long. Sometime this year, I will do the budget video and give you our living expenses of actually living in Korea in our apartments, and we'll break down everything minus the food, to give you kind of an idea of what we pay, and maybe that'll help out some people. So that'll be it. So anyway, check that out. Like, subscribe. We'll see you on there, and hopefully we'll do another video. All right. Peace.